The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thank you for tuning in to another edition of The Fact Is. I'm your host, Hollis Grant, and today on the show we are going to be talking about Omicron, and we're going to be looking at the province of Quebec in Canada. This is taken from a CTV News Montreal article dated January 11th, and it's titled, "Quebec's not the first to tax the unvaccinated. Here's what other places have done." Before we get into the article, it's been recently announced that Quebec will now tax citizens that fail to be fully vaccinated. If you don't have a vaccine against COVID, you will be taxed an additional tax. Now, the article is written in a support to Quebec. But let's get into that and see what you think about the article. Quebec may be the first in Canada and in North America to impose a tax on the unvaccinated, as it announced plans to do Tuesday. But it's far from the first in the world. Several countries have imposed cash penalties on those who refuse a vaccine, and major companies are also increasingly slapping unvaccinated workers with financial consequences. Some of the penalties are very high, especially in Austria, whose government in November became the first in Europe to announce it would create a tax. A couple weeks later, it announced the price tag, about 5,150 Canadian dollars, for every 3 months required from everyone over 14 who remains unvaccinated. That adds up to about $20,000 per person per year. Has Austria's plan worked? It's too soon to say, since it won't begin until February. Prior to announcing the tax, Austria had tried a strategy of saying that only the unvaccinated would be subject to lockdown measures. Shortly after, it changed course. Greece made a similar announcement, though a smaller group and with a lighter price. In that country, the measure only applies to unvaccinated people over 60, starting January 16th. It plans to fine them the equivalent of about $143 each month. It's Canadian, adding up to about $1,716 a year if a person stays unvaccinated all year. As in Quebec, Greece's rule was described as a way to help fund a struggling health system overburdened with COVID-19 patients. Quebec hasn't yet said how high the tax will be, with Premier François Legault saying Tuesday that $50 or $100, quote, is not significant enough for him. At least one country has opted for a different and potentially much higher financial penalty, making the unvaccinated pay for their own medical care. Singapore, which has a universal healthcare system similar to Canada's, made the change as of January 1st, deciding that unvaccinated people who landed in hospital with COVID-19 will be billed for their stay. Currently, unvaccinated persons make up a sizable majority of those who require intensive inpatient care and disproportionately contribute to the strain on our healthcare resources, Singapore's health department said in a statement. The rule only applies to people who are unvaccinated by choice and not those who are ineligible for vaccines, such as people with medical exemptions. Singapore was already refusing, however, to foot the bill for people who are fully vaccinated but who caught COVID-19 during overseas travel. Some countries have taken the mirror image approach, offering financial carrots rather than sticks. Both Lithuania and Slovakia governments are paying seniors small amounts to get vaccinated or at least get a booster. Lithuania will give $143 Canadian to anyone over 75 who gets the booster shot by the end of March. Slovakia is giving $438 to people over 60 who get a booster by mid-January. If they make the appointment by the cutoff but haven't had the shot, they're eligible for €200. Around the world, some employees are also feeling the consequences as their employees lose patience with the decision to stay unvaccinated. While there are many rules that have cost unvaccinated workers their jobs, especially in the healthcare system, only now is there a new trend of financial treatment for unvaccinated workers who stay on the job alongside the vaccinated. The UK arm of IKEA, for example, has cut its sick pay rate for unvaccinated employees who are exposed to COVID-19 and need to self-isolate, it announced on Monday. And these workers could now make as little as $164 a week, Canadian. The rule only applies to those who have an exposure. Unvaccinated workers who actually get sick with the virus will be paid full sick pay rate. The change came after the UK lessened the self-isolation period for vaccinated people after an exposure, but it kept it at 10 days for the unvaccinated. In the U.S. state of Nevada, unvaccinated people working for the state government and using public employee health insurance will be, as of July, required to pay an extra $55 a month for insurance. That's meant to cover the skyrocketing cost of frequently testing many of those employees, including the weekly test for a large number of them, state officials said. Historically, taxing the unvaccinated wasn't considered beyond the pale in some other pandemics, though the penalties weren't necessarily too stiff. The first ever vaccine against smallpox was made mandatory for all infants in England in 1853, wrote a columnist Nicholas Goldberg, and their parents could be slapped with fines and prison terms for refusing. The U.S. Supreme Court also heard a 1905 case over Massachusetts' wish to use police power to make vaccinations compulsory, and it ruled in the state's favor. But the penalty was only $5 for not complying, or about $200 today in Canadian dollars. Now, in this particular article, it's all for taxation. If you're making the choice to not be vaccinated against COVID and end up in the hospital, you're a strain to healthcare. If you choose to not have this vaccine and get sick, you should pay. So if it's the citizen's responsibility to maintain a healthy lifestyle, and it's a life decision, and it's the good of the community to be vaccinated, to be fit, to be healthy, then when will the taxation come on the obese? See, the obese are also a problem to healthcare. There's taken from an article from cardinalhealth.com. And this is back in 2016, on August 1st, 2016, is an American company specializing in healthcare. And it noted 3 ways obesity is affecting the entire healthcare system. Obesity is defined as having a body mass index greater of 30, a number calculated based on the height and weight of an individual, which can vary between males and females. This epidemic is not a new concern for healthcare and has increasing effects on the entire healthcare system. Point 1, patient health. Obesity has a variety of impacts on the body. It increases pressure of the accumulation of fatty tissue causes pressure on internal organs, leading to conditions such as high blood pressure, type 2 diabetes, chronic obstructive pulmonary disease, sleep apnea, varicose veins, lymphonia, hernia, and various insufficient and poor circulation leaves patients more susceptible to infections, skin breakdown, and surgical wounds. Now, 2, safety of hospital staff. Healthcare workers are put at risk physically due to the additional strain they incur helping the obese patient with mobility. In order to prevent skin breakdown in the immobile patient, most staff follow a schedule in which the patient's positions must be changed every 2 to 4 hours. This may require additional staff spending on the weight of the patient. If no additional staff are available, a staff member may willingly put their own physical well-being in jeopardy while repositioning the patient. And 3, financial impact on healthcare system. Increased spend on pharmaceuticals. Obesity affects the pharmacokinetics of the body, which can lead to the patient requiring more frequent administration or higher doses of medication, as well as more frequent care and vital sign monitoring by the nurse. This has the potential to increase the cost of pharmaceuticals that the hospitals are currently spending. Non-reimbursable treatment due to the additional pressure of the accumulation of fatty tissue creates the obese patient is more at risk for infection from surgical wounds. In some cases, the Center for Medicare Services standards call for hospitals and other health care systems not to be reimbursed for care related to conditions such as surgical site infections. Obesity also creates impaired mobility to the patient, leading to an increased risk for falling. CMS will not reimburse a hospital for a patient fall complications and skin breakdown that is acquired while the patient is hospitalized. Cost of equipment. Hospitals may have to consider ordering new equipment, including hospital beds, wheelchairs, bedside commodities, and walkers to accommodate obese patients. At a national conference store, the standard size bedside costs under $80. The bariatric version of the same commode costs over $170. According to the American Institute of Architects, in 2016, hospitals are seeing an increased number of obese patients are turning to design experts to help create new doorways and hallways to accommodate the growing physical size of their patients. So these are some things that the obese are causing to the healthcare system, but yet the discussion isn't happening. That discussion's not happening. Hospital staff may do everything in their power to treat obese patients. However, complications may still be unavoidable due to the detrimental effects of obesity on the human anatomy. Obesity is not always addressed, as most medical conditions are, directly to the patient. Since there is often concern around being insensitive when addressing weight issues, it is extremely important to keep top of mind the many strains that obesity causes to the healthcare system. As a society, we must work towards eliminating this epidemic through education and prevention, while also collaborating to deliver the highest quality, safe, and effective care possible to the current obese patient population. So their idea is we need to get people to a better weight, but how do we talk about it without insulting someone and saying, you're fat, you need to lose weight, what you're eating is unhealthy. Drinking a liter of Coca-Cola a day is unhealthy. Eating 5 Big Macs is unhealthy. You're eating too much. Reduce your plate. Don't have a big plate. Have a smaller plate. Now, obese people aren't taxed at a different rate. We can go on and we can talk about smokers. Smokers have huge burdens to the healthcare system near the end of their lives. We can talk about alcoholics that have the same problems, destroy their livers and wait for someone to die and have a transplant of some other liver to destroy that liver, then yet again go in for another liver transplant. You don't talk about drug addicts that are constantly in and out, ODing, using up valuable resources in the healthcare system. So these people all should be taxed as well. Or is it somebody just saying, I'm not going to get a vaccine, and if I'm not going to get a vaccine, I don't want to go to the hospital anyway because I'm okay with this cold or getting sick, and I'm aware of the risk. Much like an obese person when they crack that can of liter Coke in the morning, or like that cigarette smoker as they smoke a pack of cigarettes, or the alcohol drinker that drinks a 40 ounce of Jack Daniels in the morning. Now, you can say, yes, but all those commodities are taxed as well. And in some degree they are taxed. And when you look at Canada, heavily taxing cigarettes, but that tax isn't $20,000 a year. I'd like to thank you for tuning in to this edition of The Fact Is. I'm your host, Hollis Grant, and you have yourself a great week.
Dan, what happens every Thursday?
That would be DCR Droids Canada Radio.
And what time is it out on Thursday?
That's from 9 till 11 p.m.
Dumb question, where do you find it?
You find that at accessradio.ca.
And what's the best part?
It's free.